Here's what's coming up on today's show.
We want people to be educated. Some of these decisions they're making right now, these are decisions they're making for the rest of their life.
Welcome to the Income for Life Show. If you're looking for some common sense retirement planning ideas and want to hear how we make the complex financial world simple, then listen up so you can learn how you can stay retired. The Income for Life Show is powered by Folds of Honor, a 501c3 nonprofit organization dedicated to providing educational scholarships to the families of America's fallen and disabled service members. Now, it's time for the Income for Life Show.
Welcome to the Income for Life Show, powered by our friends and family at Folds of Honor, where we discuss various strategies, ideas, and topics around the retirement planning world in a way that hopefully will make sense to you. Our toll-free number is 888-228-8814, and our website is incomeforlife.org. And as we usually do here on Income for Life, where we're always trying to talk about everything retirement ideas, retirement strategies, etc., etc., one of the biggest things that we hear quite a bit from all of our listeners and our podcast listeners all across the country is this thing called Medicare and this Medicare planning, and how do I decipher all the Medicare options that are coming into me and flooding into me. So today we are going to have one heck of a show lined up. We have a person in our office today, in our studio, that we're going to go through the ideas around Medicare, Medicare supplement, Medicare planning, and then we have one heck of a question at the end that came in on the IFL mailbox directly around Medicare. So before we jump into today's Medicare topics and ideas, let's just remind everybody out there that if you're listening on our podcast affiliates, such as the Apples and the Spotifys and the Stitchers and whatnot, thank you very much for listening and tuning in to the Income for Life Show. And of course, the easiest way to listen is directly on incomeforlife.org. Just click on the Income for Life Show. You can listen to every one of our podcasts right there. Now, let's go ahead and jump into today's topic, which is going to be all about Medicare today. We have so many people that come to us that are saying, Matt, I have no idea how to decipher this Medicare stuff. I got a 2-foot stack of mail that I get that has just got flooded in whenever I was turning 65. I don't know what to do. So what we decided to do on today's show is we decided to bring in an industry expert in this field, in the Medicare arena, the Medicare supplements, the Medicare Advantage, the Part D drug plans. And I'm happy to introduce Bob Evanson today with R.W. Evanson Incorporated, who specializes in Medicare education and planning. And Bob graduated from Washburn University back in 1979 and started his insurance career not too far after that. So he has a tremendous amount of experience in this field. He became one of the largest insurance brokerage firms in the entire Midwest, providing guidance and services to independent insurance agents and in turn to their clients. So not only has he trained clients, he's trained other agents. So we're very happy and very pleased to have Bob in the office today, giving us some information about his expertise on Medicare. So Bob, thank you for joining the Income for Life show today. How's your day going?
You know, Matt, I'm one of these optimistic guys, and as long as I can wake up in the morning, then it is a good start.
It's a good day.
So you know what? I just want to thank you for having me in here. You know, it's always, I always look at it as always good to be invited somewhere and have a place to go as long as it's not your funeral.
That's exactly right. Perfect. I love that. And we're going to have a great show. And Bob and I are going to go back and forth today on this, all this stuff about Medicare and whatnot, because Bob, here at Income for Life, we get so many clients that call in, of course, that are looking for the Income for Life way that we do with the income that they need and having the money come in guaranteed no matter what happens. And that's been the majority of our shows that we always do. But we also get a lot of people that are talking about, well, Matt, we also need to get a Medicare plan, or we got to get a Medicare supplement plan, or we got to get this when it comes to the health insurance side. And these people that call us are so confused about how Medicare works, for example. They say, hey, I got this Part A, maybe I got a Part B, I don't know, I need this drug plan, whatever it might be. And if you're listening right now today, you may be thinking the exact same thing of, that exactly happened to me, or that happened to my mom and dad, or whatever the scenario might be. So what I'd like to do, Bob, is just kind of start just asking you some questions and get your expertise on this crazy world of Medicare and Medicare supplements and whatnot. So if we would, let's just kind of start off with what is Medicare? How can people, get some information right out of the gate on the 10,000-foot view of it?
Well, first of all, I think the main thing that people need to be aware of is Medicare is health insurance. That is all it is. It has nothing to do with your Social Security or your fixed income. It is health insurance, and it's health insurance for people that are turning age 65 or for those people that are under age 65 on a disability. And so it's as simple as that. It is health insurance, and it is probably your health insurance for the next 20 or 30 years after retirement.
Perfect.
So
Perfect.
how do you get information on it? You can Google this, but I want to make people just be aware that be careful when you go in and start Googling stuff. The majority of it is marketing sites, and you're going to be bombarded with a bunch of phone calls. But
I think a lot of people start that way, and then they realize maybe that wasn't a good idea.
Yeah. So an easy way is I tell people, hey, they can call in here and we can give them the 10,000-foot view of when do you sign up and how do you sign up and stuff like that. And our main objective here is that whatever anxiety you bring to that phone call or bring into our conference room, it stays with that phone call and it stays in that conference room. That when you leave, you say, is that all it is?
Yeah. And that's an amazing thing, because I feel like that a lot of people that will come and visit with your team, Bob, when it comes to the Medicare side, I feel like that you get a lot of, well, I didn't know it was that easy. Or maybe, I didn't know that was all it would be, because Bob, you are one of them. You are a boomer. You are right in the age of where a lot of these people are coming in. So you can relate to what these people are going through, don't you think?
100%, Matt. You're telling my age here a little bit.
I'm telling a little bit on you.
But, I always tell people, I was born in the 50s. I grew up in the 60s and went away to college like a lot of people in the 70s, and in the 80s, raised a family and started a business. And before you know it, my gosh, I'm getting ready for Medicare. Where did time go? And so, yes, I'm living this exactly like the people that are listening now. This health care, this is something that, is really close to your heart. You are making decisions that can impact your future care. So this is why you do need to do a little bit of research. I would say, Matt, the worst things that people can do is just immediately dial an 800 number off the TV and join something without
Agree completely. And like we often talk about here on the Income for Life show, again, powered by our friends at Folds of Honor, we are of the exact same view, is you need to do some, I would like to call it educated homework. I'm not really sure how to say that makes sense, but calling an expert like yourself that is an independent person that can actually look at multiple companies, multiple products. So the last thing you want to do is just call a team that has a company with a product, and that's all they're trying to basically cram down your throat. Where you're an independent firm, therefore you have multiple opportunities for people, so you can kind of shop and find the best thing for their particular situation. Wouldn't you agree?
Yeah, and that's exactly, you hit the nail right on the head. I tell people I don't want to come across as arrogant or anything like that, but this is their health plan. I could care less what company they went with.
If it works for them, it works for them.
As long as it works for them. We're not an employee of an insurance company or a government institution. We look at what is best for the client, and they make the decisions on their health care.
Perfect. Now let's go ahead and jump into the two main pieces, if you would, of Medicare, which is Part A and Part B. If you would, just kind of give a little bit of a 10,000-foot view, because a lot of people kind of have a little bit of a grasp of what Part A is and what Part B is, but then there's other people that say, yeah, I got this card and I have no idea what those letters mean. So what is A and B in Medicare?
Well, real simple. If we want to look at Part A of Medicare, keep in mind that it is your hospitalization. You're admitted as an inpatient into the hospital. It could also be skilled nursing facilities. It could be home health care. And then, Matt, you did touch that I have been around a while. I remember when hospice came out, and that this was in the early '80s, and hospice also comes underneath Part A. Now, Part A, the majority of people who have worked at least 40 quarters throughout their working life, they have paid out of their paycheck. Well, if you ever seen that deduction, Matt, that said FICA?
Oh, yeah.
No one really, what is FICA? That's your deduction for Part A of Medicare. So you prepaid your premium for Part A of Medicare.
Which is why, if I'm correct, Part A is at no cost when you get to age 65.
As long as you have worked at least 40 quarters.
Because you've already been paying in
That's right.
to that in the form of that FICA all during your working years. So Part A, in essence, is the, a lot of people call them the bigger stuff, the hospitalizations, the inpatient, that sort of a thing. And then we jump into Part B. Now, what is Part B?
Well, Part B, I always tell people, think of it as any other health-related issue you could have that Medicare would approve, with the exception of your outpatient drugs or your maintenance drugs. So it could be your doctor's office calls, your x-ray and lab work, your physical therapy. It could be your emergency room, your urgent care centers. We go one step further, and it could be encompass durable medical equipment. We used to think that durable medical equipment was a hospital bed, a cane, a walker. Even had one guy in here a long time ago that did tell his age. He said, "Well, what about an iron lung?"
Oh boy!
And so,
an iron lung.
An iron lung. Now, when did that go out? In the 40s or something like that? Now, it also could encompass CPAP machines.
Okay.
Insulin pumps, pain ports, pacemakers. So all this goes through Part B of Medicare. Now, unlike Part A, we have not prepaid the premium for Part B. So everybody has to pay a monthly premium. Now, that monthly premium is based off from your annual income.
Okay, that makes sense.
So the more you make, the more you're going to be paying in premium. But there is an extra premium. It starts out at $148.50 a month. So Part B will cost, if you're in the lower income bracket, at $148.50 a month.
Okay, so there is going to be a cost for the Part B amount.
Correct.
Based on where they are on their income thresholds, which makes sense. So let's talk about how much potential out of pocket. If somebody has a Part A and a Part B, obviously it depends on how it's billed, but Part A has a deductible. Part B has a deductible, right? So talk about that.
Part A deductible's a little over $1,400, and that is on a benefit period. So you could have multiple benefit periods throughout the year. Your Part B deductible is a calendar year deductible, and I'm going to really blow your mind on this because in today's world, health insurance deductibles, we're looking at $1,500, $1,000, $5,000.
Oh, yeah.
Part B deductible on Medicare this year for 2021 is $203.
So you're telling me that if you were used to a $2,500 deductible, for example, when you were working, or a $1,500 deductible, or whatever it might be, then this Part B deductible is only $203. What happens after that $203?
Then we go back to that old 80-20.
80-20, okay.
Medicare will pay 80% of what they approve.
Okay.
And then you are liable for the other 20%. Now, unlike the health plans a person's been used to, there is no cap on that 20% liability.
Okay.
With Medicare. So
people need to know that.
It's open-ended.
Okay.
That is right.
So that 20%, I mean, if you have a whole bunch of claims and a lot of treatment necessary, that could add up.
It could.
So you have your Part A and your Part B of Medicare. Part A is your hospitalizations and your hospice, like you were talking about, and it has a $1,400 benefit period deductible. Part B is more on the outpatient level for the most part, has a $203 deductible, and then it's 80/20. Am I saying that?
Yeah,
Am I saying that right?
correct.
Okay.
Yeah.
So now that we kind of hit the nuts and bolts of that, now what people have jumped into and they're getting flooded with information on whenever they're turning 65 is the choices that they have with a Medicare supplement plan and also the choices that they have with the newer Medicare Advantage plan. So let's talk about the Medicare supplement first, Bob, and kind of go through your kind of 10,000-foot view of the good and bad of those and how those traditionally work. And then we'll contrast that with the Medicare Advantage plans, the good and bad of those, and how you think those could benefit people. So start off on the Medicare supplement side.
Okay. Before I jump right into that, Matt, I want to go back a little bit on that Medicare Part B deductible. Every November, the federal government will come out and let everybody know what that's going to be for the next year. And that's all based off from the cost of living adjustment and Social Security. So be aware in November, you're going to, the beneficiaries, which that's what you are now. If you're on Medicare, you're labeled as a beneficiary. They will let you know what that deductible is going to be.
So that deductible could change.
It could. It could.
Makes sense. I'm glad you brought that
and
up.
Your premium of Part B will change as well. Now, so let's get into these supplements. A supplement is exactly what the term states. It is a supplement to Medicare. It will, whatever Medicare approves in most cases, but doesn't pay, then there is a supplement plan you can choose from that will help offset your liability or your expenditures on that. We used to have 10 different plans that you could choose from, and the federal government came up with all the plans. And but as of January 1 of 2020, we now have 8 to choose from. So basically, at the 10,000-foot view, you buy a supplement from an insurance carrier, and then the insurance carrier will take on whatever Medicare approves that doesn't pay. Medicare will transfer that claim to the supplement carrier, and then the supplement will pay out what they need to pay out.
And let me jump in real quick because you just hit something that I want to make sure that people understand. You said it will pay what Medicare approves that doesn't pay. So that would be, for example, that $1,400 deductible perhaps. Maybe if you have a plan that'll help cover that 80/20, that 20% of the Part B. That's what you're talking about. If it's Medicare approved, then that means the supplement will obviously pay what Medicare doesn't, which the doesn't is that deductibles and the 20%. Does that sound right?
Yeah, it does. And so, like I said, there's 8 different plans you can choose from. The one that we see the majority these days, it's when you look at these, it's called a Plan G. Basically, a Plan G of a supplement, it will pay whatever Medicare approves but doesn't pay, with the exception of one item, and that is your Part B deductible of $203. So if you have a Plan G supplement, you literally could get a quadruple bypass that runs you $300,000-$400,000, and as long as Medicare approved all that stuff, you'd only be out $203.
So with the Plan G, just so I can kind of get my brain wrapped around this well, and I know a lot of people that are listening today that are maybe already on Medicare know what you're talking about with the letters like the G's and used to have the Plan F's and things like that. So that's what we're talking about here. But on the Plan G, the quadruple bypass scenario like you talked about, and if that doctor and hospital was Medicare approved, then the only out-of-pocket that person would have for that particular claim would be that $203.
Correct. And then let's say that the poor individual had a black cloud over the top of his or her head, and after that quadruple bypass, then they went in and they had to get a hip replacement. And say you got the hip replacement in an area that it cost $80,000. As long as Medicare approved it, wouldn't cost you a dime.
Because you've already paid
That's
your
exactly
203 deductible.
That's exactly
so
right.
that 203 deductible, is that an annual
It
deductible?
is. It's a calendar year, once a year, January 1 to 12/31.
So once you, on a Plan G, again, if you satisfy that $203 on that deductible, then anything after that for that calendar year would be paid at 100%, providing you're using a Medicare affiliated doctor and hospital, right?
And Medicare approved the charge.
And Medicare approved the charge.
That is exactly
and with that, a lot of people are thinking, okay, well, my gosh. I mean, whenever I was working, I had a $1,500 deductible, and then it was 80/20 for another $5,000, and then 100% coverage after that. That's $6,500 out of pocket right out of the gate with that quadruple bypass like you were just talking about. With this Plan G on a Medicare supplement, your out of pocket is $203 per year.
That is correct.
Fantastic. And if you're listening today now on the Income for Life show, again, powered by Folds of Honor, if you want a little bit more information about Medicare, Medicare supplements, whatnot, how these work, etc., you can just give us a call and I'll get you right in connection with Bob right away so you can talk to him and his team. You can just call us at 888-228-8814. Again, 888-228-8814.
It's time to take the wondering and question marks out of preparing for retirement. You know, one of the least understood things for today's retirees and pre-retirees is how exactly you can create your retirement paycheck. Think about it. How are you going to stop working and turn your savings into an income stream to last you 20, 30, or even more years in retirement? Now, no worries if you don't know the answer to that question yet. That's probably why you're tuning into the Income for Life show, right? So let's do this. Take the education and the lessons that you get here on the show a bit further. Matt created a guide specifically for podcast listeners. It's called Preparing for Retirement: Ways to Create Your Retirement Paycheck. And it'll show you in detail the primary challenges that people face when trying to retire today. And it'll teach you the essential difference between required income and lifestyle income. To get the guide, email info@incomeforlife.org or call 888-228-8814 and simply ask for the guide. Email info@incomeforlife.org or call 888-228-8814. Okay, let's get back to the show.
We're back here on the Income for Life show. I'm still with Bob Evanson with R.W. Evanson, who is an industry expert when it comes to Medicare, Medicare supplements, Medicare ideas, Medicare planning. And if you were tuning in earlier on the show, we've been having a really neat dialogue about how Medicare works. We discussed the Part A and Part B, how those work, how Medicare in general works, and when you can qualify, etc. Now, we also talked about some Medicare supplements and how those can work. But what I want to jump into now, Bob, real quick, is these, I guess they're newer, but they're not too new anymore, but they are the new Medicare Advantage plans. I know they have a lot of traction with a lot of people across the country. There's a lot of appeal for these types of plans. Some people love them, some people hate them. So let's kind of go through the opportunities people could have on a Medicare Advantage plan.
Well, let's, if we can, Matt, let's start out and just briefly give you again that 10,000-foot view of what a Medicare Advantage plan is.
Perfect.
It is completely different than the supplement way of going. An Advantage plan, basically what happens is Medicare is outsourcing itself to an insurance company. So a person would still be enrolled into Medicare and pay that Part B premium, but if they enrolled in a Medicare Advantage plan, that Advantage plan is their health care plan. Medicare has nothing to do on claims.
Okay.
So to give a little better idea on this is that Medicare would go out to an insurance company and say, hey, in a certain area we have 30,000 eligible beneficiaries. If you insurance company come up with a health plan that has to pay for everything that Medicare would approve. A company can't say, well, we're not going to pay for that rotocuff repair. They have to pay what Medicare would approve, and they have to have ample amount of doctors in their network. So now we're going to go back to kind of like group insurance. You're going to have a network of doctors. You can be in or out. Medicare says that you can also throw things in there to your plan, like dental and vision and rides to and from your doctor's office appointments. And we're starting to see what they call a Medicare Part B give back. And that is basically like a refund of a portion of your Part B premium. So that would be like that $148.50.
Yeah, perfect.
Okay, so sounds good. Now, how does it work? Medicare says for every person that an insurance company enrolls into their plan, Medicare will pay them an amount of money per month per person to take care of that beneficiary.
Okay, so in essence, it's kind of like Medicare's way of saying, we'll pay you to deal with it. You will pay you, insurance company, or whoever you are, we'll pay you X amount to get this off of us.
Exactly. Okay. Now, it's, I think that it could be a win-win for Medicare. It could be a win-win for an insurance company, because Medicare now is not open-ended on what their liability would be. They know exactly what their liability is going to be. It's going to be that amount per month per person, and that's all they're going to pay out. The insurance company can sit back here and say, with that dollars that we get, we can manage the care now.
Okay, all right.
And such. And so to make it maybe a little bit more simpler, if I could, and I want to come back to what you do, Matt, on Income for Life. You take care of people on, and I think your term is, and I think it's a really great one, of we want to keep you retired.
Right. Well, our plan is to keep you and have you stay retired.
Exactly right.
We want you to stay retired.
Well,
that's right.
Let's go back, and again, I'm an old guy, and when I first got out of college and went into financial planning, a lot of companies out there had traditional pension plans. You worked for a company 35 years, you put in the time, and the company said, when you retire, then we're going to pay you $800 a month for the rest of your life.
And give you a gold watch.
And that's going to continue on. And so you knew exactly what was going to happen. We refer that as like traditional Medicare and a supplement. You pay a premium, you know exactly what's going to happen, and life is good. Well, funny things started happening in the 80s. People weren't dying when they were supposed to.
Exactly.
Now that sounds really, this sounds bad, but people weren't dying when they were supposed to. And they were putting a strain on these pension plans. So what did we have to come up with? Well, Matt, it's the 401k.
It's the 401k.
So let's look at Medicare Advantage. If we want to keep that frame of mind, Medicare Advantage is more like a 401k of healthcare. What you've done is transferred all the risk from the employer or the pension plan. Now we've transferred it to you, because now you have more liability on a Medicare Advantage plan.
Okay. So that analogy of moving from a corporate pension plan over to the 401k plans, where you're now on the hook for making your own decisions and you're on the hook for whether it goes up and down, etc. That comparison is just like Medicare Supplement to Medicare Advantage plan. So it basically takes Medicare off the hook, and now you, the beneficiary of this, and you're on this Medicare Advantage plan, you are now deciding how your care is going to be, because Medicare is just paying this company to do it, and they're out.
That's correct.
Right? Okay.
Yeah, that's correct. Now, when we look at nationally of how this splits up, how many people are on Medicare Advantage and how many people are on supplements, and this is just going to sound like I'm just throwing this out, but we're right at about a 50-50 split on this.
Interesting. Okay.
And we look at different regions on what regions have supplements and which regions have Medicare Advantage. Has a tendency that Medicare Advantage is really shining in the metropolitan areas. Okay? Not so much in the rural. you go out here to a little town in Bird City, Kansas, out here, you don't have very many. The population's not that large out there. And so Medicare supplements will be the route to go out there. Now, so I want to get back to how these things pay out. You will pay as you go. So you go to a doctor, you might have a copay. You go get a surgery, you might pay a percentage or a copay on a surgery.
So these Advantage plans kind of have a flavor of the old group plan where
does.
you got a copay to go in to see the doctor. Maybe there's a copay to go to the emergency room. That's language that people understand from maybe their group plan, right?
Correct.
Okay.
There are a lot of similarities. You'll have an out-of-pocket in-network and an out-of-pocket out-of-network and such like that. Now, I will say, on these plans, if it is an emergency or an urgent care, you're covered anywhere in the United States as if you are in network.
Okay, so if it's an emergency deal, you just go to wherever you
Yeah,
need to go.
yeah.
Okay.
And such. Now, when people talk to us, and I want to go back to this thing that says, this is their health plan, and they will determine if they want to go the supplement avenue, if you will, or the Medicare Advantage. And I got to tell you, we have, you can bet, or look at over 40 years, we have a large clientele, and the people that we have on the Medicare Advantage plans, we have never had a problem. And I'll tell you, I think it goes back to education.
I was just getting ready
Yeah.
to say that. It's very comparable to what we do here at Income for Life. Is when someone is educated about the good and bad and indifferent of a particular plan, then they are comfortable with ongoing understanding. And Bob, you're a lot like me, and I say it on the show all the time, and I talk to my clients all the time. It kind of sounds corny, it kind of sounds cheesy, but it's just something I believe in, and that you don't need a memory when you're telling the truth. And your clients understand that, my clients understand that. So whenever you are educating people in a way that makes sense to them about the choices that they can make, I'm of the view that that is the key to a happy retirement, is educating people in a proper way that makes sense to them, because everybody's different. Everybody has their different wants and needs and objectives, and some people will understand something better than another. So having the ability to explain Medicare and their choices of Medicare in a way that makes sense to them sounds like the right way to go, wouldn't you think?
Oh, I totally agree.
And that's a wonderful opportunity that people can have. And again, our phone number is 888-228-8814. Again, 888-228-8814. If you're listening on our website right now at incomeforlife.org, thank you very much for finding us here. If you're listening to one of our podcast affiliates, of course, feel free to visit us online, and we can get you in touch with Bob right away so he can talk to you a little bit about these Medicare plans. Which one is right for you? Should you go the supplement route, perhaps? Should you maybe go the Medicare Advantage route, perhaps? So there's some options there that you will have that Bob can walk you through and be able to get you the necessary information. And he can email you information. You can set up a time to talk to him over the phone. If you happen to be local in the Midwest area and you want to swing by and talk to Bob, I'm sure he'd love to schedule a time to have you come in. But as we finish up, as we're talking here, Bob, before we get into our IFL question of the day, let's just hit real quick on what we discussed earlier in the show, and that's the Part D drug plans. It's just another thing now that is, again, pretty new. I remember, several years ago, drug plans weren't even available. So now they are. So let's go through a little bit about the Part D drug plans and kind of how those work on a year-to-year basis, things like that, because I know you get a lot of calls on that.
Yeah, we're going into the time of year here that it's kind of like an accountant starting January 1 to April 15.
That makes sense, right?
Now, Medicare Part D plans, they came in about 2006, and they've been around several years now. And I think the main thing that I like to tell people that the government does not require you to buy one, okay? You do not have to buy a Part D. However, if you don't buy one when you're first eligible and you haven't had qualifying drug coverage, and then you want to purchase it later, then the government will impose a penalty on you, and that penalty is lifetime. So when you come in, you could come in, and we could have a participant that says, dag nabbit, Bob said, I've done everything right. Even though I grew up in good old Kansas here, he said, I didn't eat greasy rib steaks. I ate chicken and turkey, and I only taken we used to call them baby aspirins. We can't do that anymore. We call them low dose aspirin. I only take a low dose aspirin. Well, dang nabbit, I wore out 2 Fitbits in the last 3 years. Why do I need a drug plan? Why do I even need a drug plan?
That's right. I don't need this thing.
Well, so you don't buy a drug plan, and then 6-7 months later, you go in for your annual physical, and something doesn't sound right, and with your heart, and so they ship you over to a cardiologist, and the cardiologist comes back and says, now you have AFib or something like that. And so now you come back and you say, hey, Bob, I need that drug card. Well, dag nabbit, the federal government says that if you don't enroll when you first have the opportunity, you're going to have to wait until the annual open enrollment. Annual open enrollment, folks, October 15th to December 7th.
So stop there for a minute. Let's say that this guy that wore out the Fitbits and has been eating chicken and is not on any medications at all other than that low-dose aspirin, and all of a sudden that AFib happens or something happens, but that happens in April, and they don't have a drug plan. They have Medicare, but they don't have a drug plan. They have to wait until they can get on a drug plan in, when was it, October?
The enrollment is October 15th to December 7th with a January 1 effective date.
So the coverage on his new drug plan that he would get wouldn't even go into effect until that next January.
Correct.
So from that April until January 1 of that next year, those medications costs are on him.
Yes.
So everybody that is listening right now knows how drug prices are going, right? Last time I checked, they're not going backwards. I know the government's always trying to figure out a way to get those lowered, but they haven't. And any of these drugs that are high octane, high level prescription drugs could cost you thousands upon thousands of dollars in that scenario. So if they wanted to get information about a prescription drug plan, of course, they can give you a call, Bob, and they can call us here at Income for Life. But how do they go about this? Because so many of these people are just getting flooded with information in the mail. I remember this was, I would say, probably 7 or 8 years ago. I can't remember. I can't imagine it's got any different now. But I had one of my clients in here that was talking about his, pension income and lifetime income with us here, with my team at Income for Life. And he brought up Medicare. And he goes, since I was turning 65, I have about 28 inches worth of mail that I've been accumulating from every company under the sun that is all sending me this stuff, and he's bombarded with mail. What do you say to people that are just getting crushed with all of that mail?
Well, first of all, don't do a knee-jerk reaction and buy from just because you've been with a company for 30 years on a group plan that offers a drug. Shop around. An easy...
Bob, stop a minute, because here's why.
You've got mail.
Our IFL mailbag that we got from one of our clients named Janice out of Kansas City has this question that she wants to ask.
Oh, okay.
So it's interesting that Janice sent this in, and it was a while back, not a long time ago, but it was a couple weeks ago that Janice sent this in, and we were saving it because we wanted to ask you, because we knew that you were going to be coming on to the Income for Life show. So perfect timing, Janice. Thank you very much for submitting this question. If you do have a question about any retirement topic, strategy, idea, and you want to submit it to Income for Life, all you have to do is email it to info@incomeforlife.org. Again, that is info at incomeforlife.org, and we will get back to you personally and always answer your questions. But if it's a question that we would like to answer on the air, we will absolutely do that. And Janice's question, Bob, is right up your alley. So let's get into this. Janice asks, I am turning 65 and I am getting flooded with mail from Medicare and Medicare Supplement and Advantage companies, as well as Part D drug companies. How do I go through this and find the plan that is best for me? And what a perfect timing for Janice to ask this question. And Bob, we were just diving in to what do you do with all this mess? So great question on the IFL mailbag today, Janice. Thank you very much. Bob, let's talk about it. What would you advise to Janice on all of this flooding of mail that she's getting?
Well, obviously, the first thing I'm going to say is give us a call, okay? I mean, and it might be a call that lasts 5 minutes, or it might last 15 or 20 or whatever. But give us a call, and we can give you a few ideas. But let's say that you're not a person that likes to reach out and talk to somebody. What if you want to do a little bit of research on your own? Go to Medicare.gov.
Medicare.gov.
Okay, it will say the official site of Medicare. Make sure you're there. And then the drug plans and the Medicare Advantage plans are all listed right there. And you can put in your zip code and pull up the plans that are in your area. Because what is available, say, to Janice in Kansas City is not the same plans that's available to her sister in Oklahoma City. Okay?
Makes sense.
It goes off zip codes, and you can get a pretty good idea of how these things look and everything like that. And I would suggest if you want to do that, look at them, write down some questions and stuff, and then give us a call. And everything, Matt, let me tell you, I do have to promote a little bit, saying that everything we do is free. You know, I'm a weird duck, and I tell people, you know, all the time that life's been good to me. It has. I mean, everybody's had their ups and downs all through their life, but life's been good to me, and we're at a position in our firm here that we can offer all this free. We don't have to charge, and we want to. We want people to be educated. Some of these decisions they're making right now, these are decisions they're making for the rest of their life.
Absolutely. Fantastic job today, Bob. And if you are interested in learning more about Bob and his practice at R.W. Evanson, what would be the best way, Bob, that people could get a hold of you?
Well, there's two. I'm going to give you a phone number if that's okay.
Perfect. Go for it.
Phone number is 1-800-841-0560.
Give that again for everybody.
1-800-841-0560. You could also visit our website. It's a corny little. We stayed up all night one night to think of it. It's Evanson, EVENSON, Insurance, INSURANCE.com.
So EvansonInsurance.com.
Oh yeah, it was. You know, that took us a long time to come up with.
So people can reach you through your website. People can reach you through your toll-free number. Of course, they can reach. You can reach Bob directly through us as well here at Income for Life at 888-228-8814. What a fantastic show that we've had today on everything Medicare, Medicare Supplements, Medicare Advantage, Part D drug plan. One thing that I would like people to take away from this is expect to be confused whenever you're turning 65 because you're going to get all this stuff flooded to you, but reach out to Bob. Reach out to Bob's team. Visit EvansonInsurance.com because you don't have to be confused. And Bob's team will absolutely take care of you. They will explain in ways that make sense to you. And again, just like we often talk about here on Income for Life, our job is to give you strategies and ideas to help you stay retired. This is how one of these ways could be. Because if you can get a plan you're comfortable with, with your health insurance, with your drug plan. That will help you be comfortable so when you retire, you can stay retired. And like we always wrap up all of our shows here on incomeforlife.org and on the Income for Life show. And Bob, we're gonna hit on this really quick because I know this is the first time on our show here, and I hope to have you back on other shows so we can talk a little bit more. But we like to talk about things going on in the sports world that's going on, especially here locally with us, with our world champion Kansas City Chiefs, our MVP, Patrick Mahomes. I don't want his mom to get mad at me. But we often talk about things going on in the sports world. The Ryder Cup's coming up this week, things like that. So our Kansas City Chiefs took a little bit of a hit on Sunday. Patrick Mahomes, if you're listening, of course, you're always invited to come on to the Income for Life show. I know you're busy. You're a pretty busy guy going on right now and trying to get ready to go for this upcoming week. But Bob, in a nutshell, what do you think about our Chiefs this past Sunday?
Well, I thought they played pretty doggone good till the last 2 minutes.
Until the last couple of minutes, we were coming right down to it, and then those Ravens decided to take it to us. But that's okay. It's early.
That's
right. We got plenty of time. So again, thank you very much for tuning into the Income for Life show. Again, powered by our friends and family at Folds of Honor. We appreciate you listening in today. Bob, thank you very much for joining us in studio today to talk about all things Medicare. We hope to have you back. And until next time, bye-bye for now.
Thanks for listening to the Income for Life show. If you have any questions about something we talked about today or want to get in touch with the Income for Life team, give us a call to 888-228-8814. That's 888-228-8814. You can also go online to incomeforlife.org and check the description of today's show for any relevant resources and contact information. You can also find the podcast on all major podcasting apps, including Apple Podcasts, Spotify, Google Podcasts, Stitcher, and many more locations. The Income for Life show is powered by Folds of Honor, a 501c3 nonprofit organization dedicated to providing educational scholarships to the families of America's fallen and disabled service members. For more information, visit foldsofhonor.org. Information provided on today's show is for informational purposes only and does not constitute investment, tax, or legal advice. Information is obtained from sources that are deemed to be reliable, but their accuracy and completeness cannot be guaranteed. Always consult with a qualified professional before taking any action.